Snoring is a problem that millions of people and their partners face daily. When you sleep, air travels down your throat, causing the tissues to vibrate and produce the snoring sound. Although snoring is usually not hazardous, it can sometimes indicate more significant health issues. Today on WellWize, we'll list the top 5 most common reasons for snoring and provide advice on how to manage it. We'll also highlight the crucial distinction between snoring and sleep apnea. If you find this video helpful, please subscribe to our channel for more health and wellness-related content. Now, let's examine the causes of snoring. Number 1. Obesity. Obesity is one of the primary causes of snoring. Increased weight can cause additional fat to accumulate in the throat, leading to airway narrowing and snoring. Weight loss, regular exercise, and a healthy diet can reduce snoring in overweight individuals. Number 2. Sleeping position. Your sleeping position can contribute to snoring. When you sleep on your back, the tongue and soft tissues fall back into the throat, which may restrict your airway. Turning onto your side, or elevating your head with a pillow, can decrease snoring caused by sleeping position. Number 3. Alcohol and sedatives. Alcohol and sedatives can cause the neck muscles to relax and collapse, restricting the airway and resulting in snoring. Avoiding alcohol and sedatives before bed can help reduce the condition. Number 4. Nasal and sinus issues. Nasal and sinus issues like allergies, congestion, and a deviated septum can lead to snoring. Nasal blockages force someone to breathe through their mouth, which can contribute to the condition. Number 5. Aging. As we age, the muscles in the tongue and throat weaken, which can lead to snoring. Additionally, the throat tissues may loosen, narrowing the airway and increasing the likelihood of snoring. Let's take a moment to distinguish between snoring and sleep apnea. Snoring is the sound made by airway vibrations as you sleep, while sleep apnea is the pausing of breathing during sleep. Your body relaxes as you fall asleep, including the muscles in your throat. If your airway gets too small, your body will try to push the same amount of air through a smaller space, creating a vibration or snoring sound. Central sleep apnea occurs when you might not always feel the need to breathe even though your airways are open and clear. This means that even if you don't snore, you could still experience the dangerous breathing pauses that indicate sleep apnea. While snoring can be disruptive to you and your sleeping partner, sleep apnea can be a far more serious condition that requires medical attention. To reduce snoring, there are several effective approaches. Lifestyle changes. Making lifestyle changes is a quick and effective way to stop snoring. Reducing weight, giving up smoking, avoiding alcohol and sedatives, and establishing healthy sleeping habits, such as getting enough sleep and sleeping on your side, can reduce snoring. Positional therapy. Sleeping on your back might worsen snoring. Using positional therapy equipment, such as a wedge pillow or specific apparel that encourages side sleeping, can minimize snoring. Continuous positive airway pressure, CPAP. CPAP is widely used to treat sleep apnea but can also help reduce snoring. Using a CPAP machine keeps your airway open while you sleep, preventing snoring. Oral appliances. Devices like mandibular advancement devices, MADs, can help decrease snoring by shifting the tongue and jaw to open up the airway. These appliances are custom fitted by a dentist or orthodontist. Surgery. In certain cases, surgery may be needed to treat snoring. Procedures like uvulopalatal-pharyngoplasty, UPPP, and radiofrequency ablation, RFA, can tighten breathing muscles or remove excess tissue from the throat. Links to recommended products to help reduce snoring can be found in the video description. The best snoring treatment depends on the underlying cause. For instance, if sleep apnea is causing the snoring, CPAP therapy might be the best option. Consulting a healthcare professional can be beneficial. You can improve your sleep quality so that you wake up refreshed and ready to take on the day. Why not start implementing some of the mentioned remedies tonight and take the first step toward better health and a good night's sleep? Thanks for watching WellWize, and stay healthy.